Hello and welcome to the morning programming live on NTN. We're coming to you from the Information Command Center in the GIS studios. My name is Jessie Leonce for today, Thursday, the 29th of October 2020. If you're tuning in, watching on air online on our Facebook platform, YouTube, we'd like to welcome you, residents here in St. Lucia, St. Lucians, keeping abreast of things at home in the diaspora, as well as well-wishers globally. The TUI flight TOM-24 arrived at Uranora International Airport, bringing 182 travelers to the destination. This is TUI's first flight from London Gatwick since the reopening of our borders amid the COVID-19 pandemic. All travelers were met with a full complement of protocols in place, and that's the word we're getting from the Tourism Minister, Honorable Dominic Fading. I wanted to start off our programming on a positive note. We're seeing that the tourism sector is on the rebound and things are looking up. We have so far recorded 8 new cases of COVID-19 here in St. Lucia. We're going to get into the details of that, what districts these individuals are from, what their age ranges are, cases 66 to 73. We're now at 73 cases total of COVID-19. We'll be hearing from the CMO in just a moment. Also, St. Lucia joined small island developing states in a bid to the IMF for more relevant interventions contributing to their economic agenda of sustainable and equitable growth. We've seen the World Bank, the IMF, making contributions to small island developing states, but the leaders are asking for more relevant input on their part. The island's Chief Medical Officer, Dr. Sharon Belmont-George, says a plan is in place to manage the bed space at the respiratory hospital. And that's looking back at the press conference that was held on Tuesday morning. And 2 major education projects received backing from the National Commission for UNESCO. We have the details to these stories on the other end of this break. Tell a friend to tune in to NTN at this time for the latest updates from the government of St. Lucia.
St. Lucia ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique qu'on bon mais base ti boutique changer distance sociale 6 pieds rodion à l'autre I ka travail tan si vous sentez qu'on pas cordial quarantine ko pas en contact et puis l'autre en cas où t'es toi exposé c'est un écuyer free one ou ben n'importe clinique yo pour les pays a dimi à clé ça veut dire les supermarkets pharmacies et puis ATM yo accessible avant cette souhait pays à clé en plein ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tout servi jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
Thank you so much for staying tuned. You are watching our morning programming live on NTN. If you're on your way to the office this morning, you're at home about your chores. For the kids who are still home, we've had the suspension, the closure of schools due to the resurgence of COVID-19 cases here on island. We do hope that you're making the most of your days, especially by tuning into NTN for the latest developments from the government of St. Lucia. The island has recorded 8 new cases of COVID-19 in the last 24 hours. We now go to the full statement from the Chief Medical Officer, Dr. Sharon Belmont-George, with this update with the diagnosis.
Today, Wednesday, October 28, 2020, the Ministry of Health and Wellness received confirmation of 8 new cases of COVID-19. This brings the total number of cases diagnosed to date in country to 73. There are now 46 active cases isolated and in care. Case number 66 is a 33-year-old female from the Labrie district. Case number 67 is a 35-year-old female from the Labrie district. Case number 68 is a 62-year-old female from the Vieux-Fort district. Case number 69 is a 60-year-old female from the Vieux-Fort district. Case number 70 is a 37-year-old female in quarantine at the Rodney Bay Medical Facility. Case number 71 is a 21-year-old from the Grosley district. Case number 72 is a 29-year-old female from the Castries district. Case number 73 is a 23-year-old female from the Castries district. Cases number 70, 71, 72, and 73 are linked to cases 41 and 58. Case number 66 is linked to case number 61. All of the cases following testing for COVID-19 were placed in quarantine awaiting their results. They have since been placed in isolation at the respiratory hospital. It can be noted that there is a distribution of cases to additional districts, which points to a widening in transmission of the virus across the island. We must remain vigilant. We must remain committed to doing all that we can to control and to limit the spread of COVID-19 amongst us. Everyone needs to act responsibly to reduce our exposure to the virus. Anyone with respiratory symptoms such as a cough, a fever, shortness of breath, a sore throat should not be at work, socializing, or in any public place. It is important that people who are unwell seek care promptly at the closest community respiratory clinic. The Ministry of Health and Wellness, we once again remind everyone to wash and sanitize your hands often during the day, always wear a mask while in public, and maintain the separation of 6 feet from others while in public, which is about 2 arms length apart. As usual, we'll continue providing updates as new information becomes available.
That was the Chief Medical Officer, Dr. Sharon Belmont-George. They're updating you on the 8 new cases of COVID-19. There are now 46 active cases isolated and in care. We did hear from the Chief Medical Officer, Dr. Belmont-George, earlier this week, stating that if we hit the 50-man mark in terms of patients in active, in care for active treatment of the case, then they will have to make some decisions as to how they further contain the COVID-19 situation. So case 66 is a 33-year-old female from the Labrie district. Case 67, a 35-year-old female from Labrie also. From the Vieux-Fort district, we have case number 68 and 69, a 62 and a 60-year-old female. And case number 70 is a 37-year-old female in quarantine at the Rodney Bay Public Medical Facility. And case number 71 is a 21-year-old male from the Grosley district. And in Castries, we have 2 new cases being registered. It's 2 females, aged 29 and 23 years old, respectively. So do take note of these developments. They have asked us, again, to ensure that you utilize and ensure that you adhere to the recommendations in terms of preventative measures, wearing the mask, the use of the hand sanitizer, washing of hands frequently to ensure and reduce the risk of contracting COVID-19. And just to mention, case number 70, 71, 72, and 73 are linked to previous cases, 41 and 58. Case number 66 is linked to case number 61. So there are little pockets, little clusters of links that we're seeing, and we are encouraging everyone to adhere to the measures, the guidelines that have been put out there for the safety of everyone. St. Lucia joined small island developing states to bid the IMF for more relevant interventions contributing to their economic agenda of sustainable and equitable growth. During the annual meetings of the International Monetary Fund, IMF, and the Board of Governors of the World Bank Group held earlier this month, October, the government of St. Lucia joined the small island developing states to bid for more relevant interventions in their economies. The IMF and the World Bank assistance to small island developing states, SIDS, including St. Lucia, since the pandemic comprised the rapid response facility that the institution of a debt service suspension initiative and provision of funds under that facility towards budgetary support and the healthcare response to COVID-19. This initial financing has focused on the health impact of the crisis through the procurement of equipment and supplies, strengthening health systems, and the expansion of social protection for vulnerable groups. On Wednesday, during a press briefing held right here in our GIS studios, the Honorable Prime Minister said that these recent offerings were good and they've proven useful, but they're not adequate as there are other ways in which these development partners can meaningfully assist.
Some of these include reviewing the instruments that are used to assess debt sustainability. The dominance of the debt to GDP ratio and per capita income skew the discussion and do not differentiate between a fiscal position that a country is led versus a fiscal position driven by inescapable responses to the economic shocks. Ring fencing of all catastrophic debt. One proposal with respect to assessing solvency and fiscal performance is to ring fence all catastrophic debt from debt calculations, and to use a moving average of GDP to compute the debt to GDP ratio.
Honorable Chasney says simulations of such a metric would closely track the gross domestic product, but in times of shocks, it would smooth out these fluctuations. It would not consider these fluctuations. The government of St. Lucia joins the small island developing states to also recommend establishing a development and resilience building fund. Despite significant progress with respect to infrastructure and economic development, the Caribbean has been hampered with natural disasters due to climate change and other economic shocks. The fund would help SIDS in the region overcome these hurdles. The Prime Minister is also advocating for the removal of institutional impediments to SIDS.
The COVID-19 pandemic has laid bare the dependency of the region on tourism industry and its related services. With limited global travel and low levels of visitor spending, the impact on the region is significant. Caribbean countries have tried to diversify away from tourism to financial services and related industries, but these efforts have often been stymied by the disproportionate international scrutiny and regulation which have impeded the development of these sectors.
Honorable Prime Minister Alan Chasney there. The Prime Minister says that his government is hoping for a speedy and a favorable response from the IMF and World Bank officials in order to bolster their ongoing budget considerations within the Ministry of Finance. The annual meetings of the IMF and the Board of Governors of the World Group were held from the 12th to the 18th of October. The island's chief medical officer says the national management of COVID-19 cases is now in the containment phase, and as such, the Ministry of Health is working toward reducing transmission and containing the disease. Therefore, all positive cases are being admitted to the respiratory hospital for treatment and care. However, careful attention is being paid to the strain on bed space at the respiratory hospital. We're going back to COVID-19 news. Dr. Sharon Belmont-George explains, and this is coming off of the press briefing that was held on Tuesday morning. Okay, we seem to be having some technical difficulties with that. We'll come back to it in just a moment. Meantime, the Embassy of Taiwan, has made another timely donation to the Owen King EU Hospital. Ambassador His Excellency Peter Chen recently presented 1,000 face masks to the institution.
To strengthen the protection of the frontline medical personnel in the hospital. And I think everybody knows that virus knows no borders, so we have to keep on helping each other. And my embassy have close cooperation with Owen King EU Hospital. I still remember early this month, I came here to deliver ventilators and also test kits. And we need to keep on this good cooperation. I would like to take this opportunity to encourage all the people to keep on wearing masks, because when we wear masks, we protect others. When others wear masks, they protect us. So when we work together, we'll win this fight together.
That was His Excellency Ambassador Peter Shen, Ambassador of Taiwan to St. Lucia. The National Commission for UNESCO has provided some funding to the Special Education Unit and the Department of Sustainable Development for the undertaking of 2 major projects. We get the details in this report. A joint check presentation to the Special Education Unit and the Department of Sustainable Development marks the official start of 2 projects, providing reading support for students with print disabilities at the Lady Gordon Opportunity Center and strengthening the legislative and institutional framework for the promotion of science and technology. Each project receives a budget allocation of $20,000 under the UNESCO Participation Program for the 2020-2021 biennium. Director General of the National Commission for UNESCO, Marcia Symforia, says the 2 initiatives are in keeping with UNESCO's 2020-2021 strategic priorities of increasing learning opportunities for persons in vulnerable situations, with particular attention to crisis-affected populations, as well as persons with learning challenges, and harnessing sciences for sustainable development.
That St. Lucia was successful in securing funding for 3 participation program projects at the first meeting of the approval committee, at a time when the organization is itself feeling the impact of reduced funding from donor agencies, and as well the challenges faced by member states in meeting their own financial contributions to the organization, speaks volumes of the quality of the submissions that are made to UNESCO from St. Lucia. In that regard, I wish to congratulate the Department of Sustainable Development for these 2 excellent projects.
The first project, providing reading support for students with print disabilities at the Lady Gordon Opportunity Center, seeks to improve access for students with dyslexia, low vision, or select mobility impairment to reading materials in digital formats that fit their specific learning needs.
This project consists, among other activities, of a book share library that St. Lucia will be part of, which is the world's largest online system, as well as a Braille-worn device, which allows a visually impaired individual to interact with a computer without the assistance of someone else. This project arose in a timely manner, considering that the country has been impacted by COVID, and we've had to close schools yet again.
That was Minister for Education, Innovation, Gender Relations, and Sustainable Development, Honorable Dr. Gail Brigabert. Education Officer for Special Education, Dale Segiste, says this project effort is invaluable.
One of the challenges within the special education subsector is that reading is very challenging. It is difficult, and there are many of our students who actually do not acquire that skill. But as I said before, one of the key components of achieving that goal is to provide appropriate resources. And the exciting thing about this project is that it will make literacy a lot more accessible to more students.
The second project, an initiative to strengthen the legislative and institutional framework for the promotion of science and technology, has a key objective to ensure that science and technology becomes one of the vital bases for the development and growth of St. Lucia. Sustainable Development Officer coordinating the project is Berthia Thomas.
The Department of Sustainable Development is currently collaborating with the National Competitiveness and Productivity Council, the NCPC, who is in a process of developing a national competitiveness agenda for St. Lucia. And one of the outputs of this agenda is a national science, technology, and innovation policy. And we're hoping that at the completion of this, we can develop through this project, its wife, so to speak, its partner, so to speak, the National Science and Technology Strategy and Action Plan. So what we have in the policy, we want to put it into action and guide our activities.
Other initiatives attached to the project include the strengthening of the research agenda in St. Lucia, the continuation of the Science and Technology summer camps, and the hosting of the first ever St. Lucia Female Icons in Science, Technology, and Innovation Forum. Portfolio Minister Honorable Dr. Rigobert says her ministry will spare no effort to see both projects through.
We will continue to work assiduously to ascertain the successful implementation of both projects and to ensure that whatever resources are to be employed to realize the fruition of these, we will employ all the energy, resources, human capital that we have to so do, noting that successful implementation refers to a project which meets all of its expected objectives and outputs and effectively undertakes its program of activities in keeping with the stipulated guidelines.
UNESCO's project launch took place on Monday, 26 October 2020, at the Department of Sustainable Development. From the Government Information Service, I am Jessie Leonce reporting. And that report there on the work of the UNESCO, the contribution toward the education sector. If you're watching, we are live on NTN right now, and we are going over the latest updates from the government of St. Lucia. The island records 8 new cases of COVID-19, case number 66 to case number 73. So we're at the tally of COVID-19 cases confirmed to date in St. Lucia is 73. There are now 46 active cases isolated in care. And a latest notice, COVID-19 related notice we're getting from an institution is the National Insurance Corporation. And so there has been an office closure notice, and I'm just going to read it out. The NIC, the National Insurance Corporation, received confirmation that one member of its team at the Vieux-Fort office tested positive for COVID-19. The Ministry of Health has started the necessary contact tracing and testing of persons identified as being in close contact with the affected employee. In the interest of safeguarding members of the public and our dedicated staff, the National Insurance Corporation Vieux-Fort office will be closed from Thursday, 29th October until further notice. All other offices remain open. During the period of the temporary closure of our Vieux-Fort office, we encourage the public to access our services at the Castries main office, Soufriere and Rodney Bay branches as we seek to explore alternative arrangements for our Vieux-Fort customers. The NIC apologizes for any inconvenience that has been caused to the public. So another institution alerting the general public to a case of COVID-19 being registered from their institution. So please take note of that. The office in Vieux-Fort, the NIC office in Vieux-Fort, has been closed until further notice following the confirmation that one member of their staff at the Vieux-Fort office tested positive for the virus. We are going to take a break. When we come back, we're going to be speaking with Ms. Naomie Grandision. She is the Health and Family Life Educator at the Bureau of Health Education in the Ministry of Health and Wellness. And we will be touching and talking on the dengue situation. We so far registered 800 cases of dengue, and since the dengue is endemic to St. Lucia, we have seen deaths every year in St. Lucia. We'll be finding out from her what does this mean, what implications it has on our population. And I know that the Ministry of Health has been organizing fogging activities in the community. So we'll be finding out what has been happening in the communities so far. So stay with us. When we come back, we're talking dengue.
We got this. Yeah. I feel make it. Strong.
We're gonna make it.
Baby, oh God.
I am a voice of hope
up. And we stay up, yes, we stay up. Head high full of confidence, we not keep pockets tell them we never give up. Big up essential workers, rest in peace, we fallen soldiers. Corona can't go, we West Indies, one love and unity. Yeah. Don't worry about the circumstances. Don't worry, no. It's just about the faith and the madness. Together we will take our chance and let we got this. We got this. We got this. We got this.
Welcome to the beautiful and quiet town of Popsville, home of agriculture, industry, and family. And in a local coffee shop not too far away, Devin meets up with Keisha to share what he's learned from his persistent organic pollutants workshop. Tell me, Keisha, have you ever heard about POPs?
POPs? What's a POP?
POPs, short for persistent organic pollutants, are a group of carbon-based chemicals that are harmful to our health and to the environment. According to the Stockholm Convention, POPs have been classified as harmful due to their persistence, bioaccumulation, toxicity, and long-range transport. This means that POPs can exist for many years and can seriously affect our health and the environment. That's right, Keisha. So pay attention to these main sources of POPs. To date, there are 16 known pesticides that have been identified as persistent organic pollutants. POPs, pesticides including DDT and lindane, can especially have long-term effects on our health and environment and should be avoided at all costs. Polychlorinated biphenyls are chemicals found in some industrial equipment manufactured before 1985 and were used to reduce the occurrence of fires in electrical equipment. Try avoiding contact with these items. Perfluorooctane sulfonic acids, or PFAS for short, may be found in several common household items that make everyday life easier. So pay attention to the type of items you choose to buy. Brominated flame retardants, PBDEs and HBCD, are man-made chemicals added to a variety of products such as dashboards and foam in seats to make them less flammable. Unintentional persistent organic pollutants are formed due to several chemical processes or improper combustion processes, such as open burning of waste. So you see, Keisha, POPs may be found right under our noses.
So what can happen to me if I'm exposed to these POPs?
Well, short-term exposure can cause symptoms like headaches, dizziness, and nausea, but staying in contact with these chemicals over prolonged periods and exposure to high concentrations can potentially make you very sick. Special precaution must be taken as pregnant women and developing children are most at risk when exposed to POPs. So now you know a little bit more on POPs, where they may be found, and how they can affect you. For more information on how to manage and dispose of POPs containing products and waste, contact your local waste management agency or visit www.stopthepops.com for more info. Sometimes danger lurks where you least expect it. The more you know, the healthier you can grow.
What does coronavirus have in common with love? Both are highly contagious. Spread love, not the virus. Like you, COVID-19 loves a lime. Beach, river, or fed. Coronavirus is like these people who track every lime just to invade. The best way to put off invaders? Cancel the lime. Spread love, not the virus. Keep you and your crew corona-free. Live to lime another day.
Together let us win this war. Say Lucia be a soldier. Together we can beat this corona.
Thank you so much for staying tuned. We are live with our morning programming coming to you from the Information Command Center. St. Lucia records 8 new cases of COVID-19. We hope that you are adhering to the recommendations from the Ministry of Health and Wellness. The use of the mask. You know, early on it was being spoken of, and persons were asked to use the mask, use hand sanitizer, observe the 6-foot distance, hand wash as much as possible. And you know, for some, if it didn't dawn on you then to do it, it is important now, because we're having clusters of COVID-19 cases emerging in the various communities, and we don't know who has COVID-19, who doesn't have it, so it's better to take precaution. We are moving away from COVID-19 talk for just a while to speak on a situation, another health matter, and that is dengue fever here in St. Lucia. We so far had, I believe, 800 cases. And here to give us the information, our status as it relates to dengue fever is Ms. Naomie Grandision. She's the Health and Family Life Educator at the Ministry of Health. A special good morning to you. A usual face. We appreciate you coming every time.
Thank you so much, Jesse. It's always a pleasure to be here, and it's so important that we disseminate the information as much as possible, and I'm grateful.
Wonderful. The dengue situation in St. Lucia, give us a clear picture of what we're dealing with and what indications it's giving to us. Because if we have such high cases, it means that we have a prevalence of vectors.
Yes, Jesse, the COVID-19 seems to be big on...
Dengue?
No, I know,
okay.
But COVID-19 seems to be big everywhere, on the news, internationally, locally. We know that there are 8 cases that were confirmed yesterday. However, compared to last year, let's just look at the total cases, confirmed cases of dengue last year. According to the last report I received, the total amount of cases we had was 20, Jesse. Last year, for the entire year. And presently we have, as you said, more than 800. And so what is this telling us? That we need to also focus significantly on how to prevent or manage dengue. Because, it's serious. We've had 3 people who passed away. And, just connecting it to the pandemic, there are a lot of people who can't buy their medication on time, and so maybe their immune system or their body system is compromised, and hence the reason why it's even more important for us to adopt these preventative measures. Taking personal responsibility is number 1, because the authorities can only do so much, and the fogging and everything is not as effective, although it is helpful in a short space of time, as dealing with the crux of the matter, which would be the larva and the initial stages to disrupt the stage of development of the mosquito when it lays its egg, etc. So I want to speak to primarily the prevention aspect. Because say, for instance, you say, oh, I'm taking a walk around my house every week. I'm looking around inside my house. I'm doing all these things that they say, but my neighbors are really not complying. Or I would go out somewhere and just standing around and I feel like I'm being beaten. I want to speak to using certain things also, apart from checking for those breeding sites, which is you should do at least twice a week. Because it takes, the cycle takes 2 to 3 days. This mosquito is intelligent and it breeds very quickly. So the insect repellent, we have a lot of persons who are not very excited about it. Some people are not into, the chemical, the DEET and so on. There are other approved substances that can be in the repellent that are beneficial, and there's also the natural one, which has been approved. Now, a lot of the other natural things have not been approved, or there's not enough research to indicate that they're very effective. However, that is one of the things I think we need to invest in also to help, and help to protect us during the hours where the mosquitoes are most dominant. So that would be at dawn and dusk. if you notice, when the sun is rising in the morning and when the sun is about to set and at nighttime, that's when you find the population or the amount of mosquitoes around much more significant. So I have seen that we have some natural products or in St. Lucia being produced by St. Lucians actually. There are creams, not only the sprays or the aerosols. According to the CDC, apart from the DEET, we have picaridin, and we have IR 33, 35. We have the natural one, which is the oil of lemon eucalyptus.
Okay.
Which, if you look for the active ingredient in the insect repellent, then you could be assured that that would be effective. There are others, but most importantly, the directions. If you have difficulty reading through the directions, whether it be for the eye or just literacy reasons, speak to somebody to read it out for you and take note of how to use it the right way and how often the use of it, so that you can, when you are out, you can spray the exposed areas of your skin and the clothing itself to help to keep the mosquitoes away. The other thing would be the long sleeve clothes at these times when the sun is rising and setting, and preferably light colored long sleeve clothes that cover your feet and your hands. I want to bring to the fore, the reason why I'm bringing this up, because I am going to talk about disrupting the cycle of the mosquitoes, but there are so many mosquitoes, Jesse. And I was just having a conversation as to why do you think literally everywhere you go, you just feel like the mosquito population has risen. Have you had that experience?
I'm feeling an itch now.
You know, and I was having a conversation with a friend, and she says, why do you think that we're having such a difficulty with dengue? And just off the top of my head, I think many cleaning campaigns, maybe by the churches and community groups, were probably put off earlier in the year because of the COVID-19 pandemic.
That's a good observation.
Yeah, and I think even, as I have said, the despondency and the depression in people, their level of motivation and active, you know, the way they would have been active, walking around the house, maybe doing things. And even before that, a lot of people weren't doing it. Even us, we probably wouldn't even have the time to do it as much as we would like to, twice a week. Some of us don't know that we're supposed to do it at least twice a week, or, you know, just go around and check it. Some of us, our grass is growing, all these leaves are collecting the water on the roofing also. Maybe because of finances too.
And I think there was a racket shortage as well, because I love to I love to purchase the rackets from a particular store here in St. Lucia.
Right.
And they were out for quite a while. And I just realized they've restocked. So I think
so even that,
yeah, it's a combination of things. So
yeah, which is non-toxic.
What are the stores like in terms of getting access to your repellents, getting access to the items that the bop, the bacon, the fish, these things, you know, how often are they restocked and so on?
Yeah, so yeah, we need to look around, and I know the finances are tight. As I said, I cannot speak to a lot of the natural things being effective, but of course people are free to explore what can work for them. The oil of lemon eucalyptus is, as I said, a natural alternative. For children, though, we need to, of course, cover them, dress them, cover their strollers with maybe mosquito netting. I use a child-approved insect repellent. I just had the nurse show me one of them. I can't remember the name off the top of my head right now. But it's a lot about the reading. And
you can get the child-approved ones at the pharmacy. So you don't go to the shelf, you go to the pharmacy to get it.
Right, wonderful. And, you know, don't put the repellent on their hands, on their face, and all these things, because, of course, you know,
you cover their eyes.
Or their eyes or their mouth, or even cuts and bruises on their skin. You try to avoid that. And we have to also consider that, based on what I read here from the CDC, The oil of lemon eucalyptus is actually not good to put on the children.
Okay.
So, and we're talking about the younger ones.
But you know, essential oils are usually harsh.
Yeah,
you know,
very
on the skin.
strong.
So you could perhaps dilute it. I don't know what could happen. But I know citronella is also good for some persons.
Yeah, so citronella, I know we have the candles. As I said, the natural options, people are free to explore them. But just based on my research, it's not on the list of the ones proven to be very effective.
Okay.
I'm not saying that it cannot work for others. People out there, and I mean, when I was at the health center, I had a number of people tell me what they do and so on. So again, maybe it may be effective, and the institutions have not validated that. So people are free to explore as long as it is safe for them.
Okay.
So that is one. And so we have to attack the mosquitoes from various angles. So within your home, I mean, you only need a spoon of water. The mosquito only needs a spoon of water for it to do what it's doing. So any stagnant water at home, in vases, in your dish drainer, in a toilet that is not being used, in the jerry cans that you're collecting the water or other things that are uncovered, you need to check it out. You need to go outside and check it out, the saucers. There are even the crab holes, which is like problematic for some people. The environmental does have the thing where they do larvicide, and of course the manpower is limited. I guess people can call them to find out if there are places where they can get it, but also you can put some oil. If there's a particular area that's always been filled with water beyond your control, you can put some oil to cover the top of the water so that the eggs will not be able to go in there. So that's another trick that can be utilized. Because there are some areas, no matter what you do, the water just collects there.
Over and over.
Over and over, and if it's, I mean, low enough, and you could just cover it with the oil, the cooking oil you use, and you just have there.
Okay.
And you may throw away. You can utilize that.
So you starve them of oxygen.
Yeah, and I mean, if the eggs can't drop into the water, the other thing would be, if you do see your drum has larvae, please wash it and scrub it out, because the eggs will still be there and they can last for a very long time. I mean, the eggs can stay there. And dengue is endemic to St. Lucia, meaning that all throughout the year people can get dengue. So you need to scrub. So twice a week, do your checks in and around your home. Encourage the people around you to do the same. Protect your skin when you are going out. And the reason why, I want to say something. If you, for instance, suddenly started feeling ill and maybe perhaps one of your organs are going bad, for whatever reason, just unusually you have to go to the hospital, or you have a chronic condition and there are complications like with diabetes. When you do get to the hospital, because of the amount of admissions for dengue fever, you may end up spending quite a while in the emergency room waiting for a bed. And the other thing would be that you can get dengue once, you can get dengue twice, you can get it again, because we don't have just one serotype of dengue. We have 4 serotypes, and then it just gets worse. So even taking the precaution can help in terms of the burden on our health resources, and also for you, if you have a parent or mother who has something significant and who wants to get the help, the persons who come in for dengue fever, they're coming in because they're concerned and the children are sick and whatever, and they're filling up the hospitals. So that's problematic. So, and you can't get it again.
Yeah.
So we need to continue. I think all of us need to up our game. All of us need to up our game against dengue fever, because it can affect your internal organs. It can cause bleeding. I mean, if there's bleeding in your vomit, if there's bleeding in your stool, from your gums, from your nose, the tiredness, the faint feeling, dehydration, the high fever, even jaundice, which would be an indication of something happening negatively with your liver. These are the very severe symptoms of dengue, which you would need to get emergency help as soon as possible. And then we have the ones that are more on the mild side, which would be the eye pain, the joint pain. Pain, it just pain.
The fever. Yeah.
Muscle pain, you name it, just bone pain. It's just, these, although considered more mild, can cause you to feel very sick. And a fever also, if you get a very bad abdominal cramps, that is a severe symptom also of dengue fever. So all these symptoms that I'm talking about, you need to go and check it immediately. And as I said, prevention is better than cure, or even prevention is better than sitting in the emergency room or sitting at the health center.
Absolutely.
For hours.
What is the education, what is the response that your team has been getting in going into the communities to get people to get them to understand that this is no joke? You need to be vigilant. You need to look around your community, around your house. What reactions, what reception are you getting out there in the field?
I think the reaction, people generally listen and they feel like they've heard this information over. Some people feel like they've heard this information over and over again. That's just from my experience. I remember this lady was saying, oh, what can you do? What can you do? Because you're doing so many things and there's still endless mosquitoes. So you just have to know how to take care of yourself. And if it happens, you just have to learn how to take care of yourself. And other people will listen attentively. I can't say what's in their minds. But I think just reiterating the message and letting people know how severe it is and that it is of great concern. We have so many cases. The COVID-19 is new. It's all over the world. But dengue fever has been causing quite a bit of concern. We have deaths. We have the numbers climbing beyond 800. So I think what we're trying to do now more so than ever is to really bring out the message of upping our game and really telling persons out there that do your part, just do as much as you can do. Take personal responsibility, because if we take personal responsibility, if all of us do it, then you would see a big difference. You would see a big difference. So that's what we're really encouraging persons to do with the dengue fever. Yeah.
Okay. And in the communities, I know that the fogging is happening, as you mentioned. Environmental health is doing the fogging. If you could just reinforce that this is, a part attempt, because persons are saying, when are you going to come into my community to do the fogging? It's not the be-all and end-all of management of dengue.
I remember when I was young in Sufre, I remember that the memory of the fogging and the regular fogging was there. And you find that a lot of the older or more mature population would express quite a bit of grievance about the not enough, as they would say, or not as much fogging as there was in the past. There's a lot that we have learned over the years, and we cannot continue to do something as regularly or as the main way to control the mosquitoes when there's so much that we've learned about some of the ill effects of it, and the fact that it is not as effective, or far from as effective, as dealing with the eggs and the larvae, the stage of the mosquito development. All you are doing is killing the adults. And sometimes when they know that you come in, they shift their position, they go further down into the community. And we know that generally insects and different species, they can develop, they get accustomed, as I would say, to these pesticides and insecticides. And then you have this chemical which can have respiratory effects and other effects on people. So it is more as a last resort, because you kill off the adults and the eggs are still there. By the time you check yourself in 3 days, you have another set of adults. And then what? We're supposed to come back and fog again, right? But environmental health, I would prefer them to speak to some of a lot of the interventions that they're doing. But they are fogging. They are going outside in the priority areas, and they are fogging and following their specific patterns in terms of sticking and doing the fogging and doing it again. But we need to get the assistance from the public. I think, my opinion, in the past, the mentality of our people and community work was there more. So persons would take their health a bit more serious. The cleanliness of homes and outside of homes, the garbage disposal, things like that, the silting of rivers. There's just a lot that the community would have been aware of. So to a certain extent, we were helping, I think, back in the day with less people on this earth, we're helping a lot with supporting environmental health with the dengue situation. So a lot of us have to change our habits and not just depend on killing the adult when you just have more eggs, you know, and the larva, and then more eggs again, and then more eggs again. So we need to take that into consideration.
Okay, and as we wrap up for our next interview, if you just give us some final words and appeal to the general public to close.
I just want to say to everybody out there that we need to really step up our game, that if we continue to have the admissions rising and rising at the hospital, there are a lot of other severe conditions that may not get the attention that it needs. Apart from COVID-19, there are so many other people who have been dying. I think every day I'm hearing the death toll going up. And so we need to up our game, check for the insect repellents, wearing the long sleeves, looking around your home for the breeding site. The fogging is not the most effective way to manage the mosquito, the Aedes aegypti. So personal responsibility is what is really going to help, because you can get dengue more than once, and there are 4 serotypes of dengue. So I just wish you just take all the precaution apart from continuing with the protocols and the guidelines for COVID-19.
Thank you very much, Naomie Grandision, the public from the Ministry of Health and Wellness, Health and Family Life Educator, speaking to us on our dengue situation. We've gone beyond the 800 mark in terms of the diagnoses here on island for cases of dengue fever. We have had 3 succumbing to the dengue fever, and so we hope that you out there are ensuring that you look around your home, ensure that you're not facilitating and accommodating any of these vectors and the proliferation of these vectors overall. We're due for a break. When we come back, we have our final segment for the morning. We have Mr. Jermaine Anthony from CAMDU to speak to us about continuing professional development, the effort of CAMDU right now to help individuals who are dealing with the skill, the mismatch. You know, you have persons who are have education, but it's not matched to the skills that are in demand. So stay tuned for that coming up after this break.
What a beautiful morning in Popsville. Time to check the crops. Uh-oh, the insects are back. Farmer Ricky plans to double his dosage to get rid of these pests once and for all. Oh no, no more insecticide. Well, off to the store we go. Hey, it's good old Joe.
Good morning, Joe. I'd like to get 4 bottles of Compound V, please. I'm double dosing to fight back the insects.
Compound V, you said?
It doesn't sound familiar. Let me see what you have.
Ricky, where did you get this product? It doesn't have proper label information and could be filled with highly hazardous chemicals called persistent organic pollutants. You should really get one that's POPs free, which is safer and approved for pest control. Ricky, it's time we talked about the dangers of misusing highly toxic pesticides. Some pesticides contain highly hazardous ingredients that can harm you and your loved ones if handled incorrectly. So when we improperly store pesticides, it can affect our health in the long and short term. To be safe, make sure to remember these following tips to avoid unnecessary chemical exposure. It's important to always read your label fully before using any treatment on your crops. To avoid dangerous contact with pesticides, including airborne insecticides, make sure to wear appropriate personal protective equipment. Apply the recommended chemical dosage and use far away from human contact and from active winds. To avoid cross-contamination, make sure to follow these simple steps to dispose of pesticide containers. And no matter what you do, don't throw it in any old waste bin. Always make sure to triple rinse, puncture, and store separately for proper disposal. And for an even safer approach to pesticide use, consider switching to organic farming and other integrated pest management processes. For more information on how to dispose of hazardous pesticides, contact your local waste management agency or visit stopthepops.com for more details. Sometimes danger lurks where you least expect it. The more you know, the healthier you can grow.
Better yet, use soap and water. We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No, no.
Advice is you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Cette lisi ka registre vermin corona ek I ka fait mouvement ek en chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique qu'on bol en mai base ti boutique changer distance sociale 6 pieds Rodyon à l'autre. I ka travail tan, si ou senti ko pas cordial, quarantine ko, pas en contact et puis l'autre, en cas où te toi pe exposé. C'est un écouye, free one ou ben n'importe clinique yo pou. Les pays a dimi à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tout servi jidla à toutes les.
Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join.
Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
Thank you so much for staying tuned. We continue with our morning programming. We have in studio Mr. Jermaine Anthony. He is a curriculum specialist at CAMDU for technology integration. And he's here to speak to us about continuing professional development, and that's an initiative on the part of CAMDU to help address the mismatch in the education of our youth and the jobs that are in demand right now. Special good morning to you. Thank you so much for being here.
Good morning, Jesse. Thanks for having me.
We've had to reschedule a couple of times, but I really do appreciate you being here to speak to us about this initiative of CAMDU. Tell us more about it.
Let me say it's not specifically an initiative of CAMDU, but it's an initiative that is coming from the Commonwealth of Learning together with Coursera. And what I'm here to do this morning is to try to promote that initiative. It's called the Coursera Workforce Recovery Initiative. And what this initiative is about is to make available the thousands, in fact, about 4,000 courses that are freely available on Coursera to all of our citizens. And the idea is that they can take these courses online and they can get really highly valuable certification.
Okay. If you could just, well, from CAMDU, you're best placed to speak to us about this situation in terms of the mismatch in our educational offering right now here in St. Lucia and the jobs that are growing in demand right now.
Yeah, we recognize, I mean, for a long time, it didn't take COVID for us to realize that, but there are a number of job placements that require specific skills, and many of these job placements require, I would tell you, a higher level of digital literacy. And so we're finding that the curriculum is a bit slow in responding to the kinds of job skills that are required in the workplace. I can also tell you that a curriculum review process has begun. It is, well, in its initial stages. And the idea is to really make the curriculum itself more relevant in terms of preparing young minds for dealing with a more fluid, flexible, unpredictable kind of situation. And if I can speak for myself, I would say we really need to teach our young kids how to think, how to learn, how to be more critical in their analysis and their thinking, how to create, and of course collaborate. So those are actual skills that should really take precedent, as opposed to just teaching students to remember a set of facts and to remember specific things for an exam. So that is the way we're going. And if you look at how online learning has really proliferated, it tells you that we need to pay more attention to how people learn, how they learn in different, through different media, and make the learning more appropriate to individual clients and not just a one-size-fits-all.
Okay. Speak to us about the offering, the Coursera Workforce Initiative. There are classes. Speak to us about the format it's taking, because we have quite a few persons who right now, unfortunately, are out of a job. They have time, So speak to us about how they could fit it into their regimen.
First, I think several solutions would have been aware already of Coursera.
Yes.
Some of us have taken courses on Coursera free of charge. Now, some of the courses are available free of charge. Some of them you have to pay for. But in the main, most times you would have had to pay for the certificate if you wanted the certificate.
Yeah.
Under this initiative, you actually get to do the courses for free, and you get the certificate for free. Wow. And this was an initiative that Coursera agreed to undertake due to the COVID situation, recognizing that the face-to-face learning, brick-and-mortar apparatus would not be very effective in these times during the pandemic. And so they've made a lot of their courses available online at no cost, and the certification free. I think so far we have maybe 7,800 or so applicants who have applied through the initiative that we've been advertising through the local media and through social media as well. And they would have noticed there are a number of different formats for the courses. There are short courses, there are 3-month-long courses, there are 4-week-long courses. And so there's a lot of flexibility. So And we also know a lot of the people applying from St. Lucia are interested in computer-related studies, they're interested in hospitality, they're interested in accounting, a whole range of areas. But it is flexible in the sense that someone can take a short course that requires them to do the equivalent of 4 weeks commitment. And when they say 4 weeks, you can actually sit down and complete the entire course in a week. It's self-paced in many cases, so there isn't necessarily a facility there with you, but you can go through the course material yourself. And so it really depends on your circumstances. You may be employed and do the course and take the full 4 weeks. You may be someone who's at home, you've been displaced by the pandemic, and so you have the time so you can spend the entire day and complete the course in 1 week. So when we first launched the initiative, we had targeted persons who were unemployed. But thanks to the graciousness of Commonwealth of Learning and Coursera, they said, well, let's open up to everybody. And so we've had more than almost 8,000 applied so far. And I will also want to add that we've advertised a few deadlines before, and that is because we were given those deadlines. And since the response, and not just in St. Lucia, but throughout the Caribbean, I think Guyana has more than 16,000 people who had applied in a short space of time. So they decided, why not open or extend the deadline a little longer. But for now, the deadline we're operating with for people to apply is October 30th, which I believe might be Monday.
Okay. And the certificates accredited?
Yes.
Okay.
Let me just add to that, with the certificates, there are actually courses that are designed by, accredited universities. Yeah.
Okay, wonderful. Speak to us about the emerging trends in this new COVID world, I should say. We're seeing that there are job opportunities because you're seeing that businesses are now borderless because persons are working from home. You have the e-nomad trend emerging. Can you speak to some of the opportunities within Coursera in terms of the subject areas that persons can capitalize on to make the most of, capitalize on the opportunities that the COVID-19 situation is presenting?
So we've noticed some of the courses on there are not what one might call just academic courses.
Yes.
Some of the courses focus on professional development in different areas, for example, soft skills. Some of the courses actually focus on how to handle an epidemic. Okay, so there's a whole range of courses on there. And the learner just basically needs to have an idea, a concept of what they want to do, what they enjoy doing, or what might help them upgrade themselves at the present job. And so out of the 4,000 or so courses, I'm sure there's a course or courses that anybody can find to be suitable for whatever their career or vocational interest is.
Okay, wonderful. Yeah. And as we just wrap up, if you just remind the public as to how soon they can apply.
So the applications have been open, since I think July of this year. We had a bit of a slow uptake, but I think thanks to Jamie Alton, who works with the Prime Minister's office, when we sent the advertisement to him, he was able to put it in the Prime Minister's social media apparatus, which happens to be quite effective, and we got a large boost in terms of applications. If you're looking for that application form, you can go to the CAMDU website. You could just Google CAMDU and you'll find the CAMDU website pops up. The application or the site is there. You'll see it popping up on the front page. And all you have to do is apply and wait a couple of days, and you should find that you will receive an invitation from Coursera, to register, and then you choose your course. We also have one young lady by the name of Cynthia Hausen, who is our local student support person, and she has been very good at assisting people with deciding what courses are best for them, if they're having any technical difficulties with logging in, with locating specific tools. Some people may not have seen the invitation because the invitation went to their spam box and all of that. So she's been very helpful. And so I would encourage everybody, no matter how, if you're not too confident about learning online, still give it a try. You have about maybe 5 days left to take advantage of this once-in-a-lifetime opportunity.
Wonderful. Thank you very much for your time, Mr. Jermaine Anthony, the CAMDU, an officer there, speaking on the opportunity for St. Lucians to have some professional development learning and take advantage of some courses online from Coursera. Thank you very much, Mr. Anthony, for your time.
Thank you again.
A specialist in technology integration at CAMDU. Thank you so much. Do enjoy the rest of your day. It's all the time we have for now. We're wrapping up with the morning programming live on NTN. My name is Jessie Leon signing off for now. Do stay tuned for more programming here on NTN. We're keeping you abreast as to what's happening from the government of St. Lucia. We know, you should be aware of the new cases of COVID-19. We've recorded 8 so far here in St. Lucia. And we've also skyrocketed in cases with dengue fever, over 800. So please take note of that. You already know the measures that you need to take in and around your home for your protection, to protect your own family. So please take note. Goodbye.